Hi, I am Krista Heinrich. I am one of the clinical pharmacists in the Baylor Community Care Clinics, and today I'm going to be talking to you about your warfarin therapy. Warfarin is an anticoagulant, also called a blood thinner. Anti means against, and coagulant means to thicken. Vitamin K works in the liver to make clotting factors. Warfarin works against the vitamin K and blocks the clotting factors. So, if you block the clotting factors, you get thinner blood. And that is why warfarin is called a blood thinner. Warfarin starts to decrease those clotting factors 24 hours after the first dose. However, it can take 2 to 5 days for you to see the full effect of your warfarin. That's why when we change your warfarin dose, we like for you to follow up in 7 days so we can see how the new dose is working for you. Remember, if we end your warfarin therapy, it may take 5 to 7 days for warfarin to leave your body. There are multiple reasons patients may take warfarin. One reason may be that you have had blood clots in the lower parts of your legs, or that you have had blood clots in your lungs. You could also have an irregular heartbeat, which is called atrial fibrillation. Some other reasons you may be on warfarin include stroke, prevention, or for more mechanical heart valves. Just as there are many reasons for patients to be on warfarin therapy, each patient may need to be on warfarin for a different amount of time. How long you will be on Coumadin will depend on your unique medical needs. Remember that if you get pregnant while on warfarin, to let your provider and Coumadin clinic know, because we may need to stop your warfarin therapy. Now we are going to talk about the best way to take your warfarin. Always take your warfarin as directed. Take your warfarin at the same time each day. The best time of day to take your warfarin is in the evening. This is in case your INR is too high or too low and requires a dose adjustment. Never skip a dose. However, if it has been less than 12 hours since your last dose, go ahead and take today's dose. If it has been more than 12 hours, do not take today's dose. Just wait and take your normal dose tomorrow. Lastly, never double up a dose. Sometimes taking your medications can get complicated. To help that, you can use a pill box. Just ask your medication management team and we can provide one. If you run out of your medication, please call the Coumadin clinic for a refill so that you don't miss a dose. Don't try to take a friend or family member's medication or stop taking the warfarin. Missing even just one dose can really affect your INR and how thick or thin your blood is. Your warfarin tablets come in a lot of different colors. The 1 milligram is pink. The 2 milligram is purple. The 2.5 milligram is green. The 3 milligram is brown or tan. The 4 milligram is blue. The 5 milligram is peach. The 6 milligram is teal. The 7.5 milligram is yellow. And the 10 milligram tablet is white. Whenever you pick up your warfarin from your pharmacy, always double check. Do the pills look different from normal? Are they a different color? Are they a different shape? A lot of medication errors are found by patients. So if something seems wrong, always double check with your pharmacist. If you happen to go home and learn that you have both the brand and the generic of warfarin, only take the brand or the generic. Do not alternate between the two. Just take either the brand or the generic. The INR is a blood test that you get to see how thick or thin your blood is. Everyone has a different INR goal, and it's a good idea to write it down to see what range you should be in. If it's below, that means that you are at a higher risk of having a blood clot and that your blood is too thick. If your INR is too high, that means that you have a higher risk of minor bleeding and that your blood is too thin. Once your warfarin dose is stable, you can increase to check your INR to every 4 weeks. This is a reason to make sure you are taking your warfarin exactly how your doctor prescribed it. Remember that illness can affect your INR test. If you become sick with a fever, the flu, or an infection, call your health team. If you have vomiting or diarrhea that lasts more than 1 day, please also call and let your doctor know. Warfarin interacts with a lot of medications. For example, if you have a headache or some pains, would you take Tylenol Advil, or aspirin. The one that we recommend is Tylenol, whose main ingredient is acetaminophen. The reason we don't want you to take Advil or other medications similar, like ibuprofen, Aleve, naproxen, or Motrin, is that these medications can increase your risk of a stomach bleed. Aspirin can also increase this risk, so before you start an aspirin product, always check with your provider. Some antibiotics can change the level of warfarin in your body. Antibiotics are important to fight off infections, and it's important to take your antibiotic as your doctor tells you. However, always let your Coumadin clinic know right away if you begin any antibiotics. They can let you know if your warfarin dose needs to be adjusted. Before you take any new prescription over the counter or herbal supplements, always go ahead and call your Coumadin clinic to make sure that this medication won't interact with your warfarin and that it'll be safe to take the new medication. To be safe, it is always best to bring a list of your medications with you to every doctor visit. Some other things can interact with warfarin as well, such as alcohol, exercise, or smoking. Binge drinking or drinking more alcohol than normal can increase your INR and make you at a higher risk for bleeding. If you start a new exercise program, please let your Coumadin clinic know, as this can affect your INR and we may need to adjust your warfarin dose. If you increase or decrease your cigarette intake, please also let your Coumadin clinic know, as this can affect your INR and we may need to adjust your warfarin dose. The foods you eat can also affect your warfarin therapy. The foods high in vitamin K can make your warfarin not work as well, because vitamin K works against warfarin. Some foods high in vitamin K are green leafy vegetables such as spinach, celery, and broccoli. This doesn't mean you can't eat these foods, it just means you need to be consistent and eat the same amount each week. A good way to do this is to use a measuring cup and make sure you have the same number of servings each week. Although lots of food with vitamin K are green leafy vegetables, there are some, like coleslaw, that actually have more vitamin K than celery. Other food that have vitamin K that you may not know are foods such as Ensure supplements, soy, garlic, and mayonnaise. If you have any questions about the foods you are eating, please call the Coumadin Clinic and your medication management team can help you. You may notice some common side effects from taking warfarin therapy. Some of these include small bruises, gums bleeding for a few seconds after brushing your teeth, or that you may bleed easier from cuts, such as when you nick yourself shaving. However, you should be able to control the bleed. If not, that is a sign that you need to seek medical attention. There are some signs to watch out for while on warfarin that you should stop warfarin and seek immediate medical attention. Some signs that you are having a very serious bleed are menstrual bleeding that is heavier than normal, red or brown urine, bowel movements that are red or look black or tarry, bleeding from your gums or nose that doesn't stop quickly, vomit that is brown or bright red, if you cough up anything red, severe pain such as a stomachache or headache, a cut that doesn't stop bleeding, a serious fall or bump on the head, dizziness or weakness. Some signs that you might be having a clot are new pain, swelling, or redness in your arm, leg, or foot, new shortness of breath or chest pain, vision changes or loss of sight in one eye, sudden onset of slurred speech, numbness or tingling anywhere in your body, sudden weakness on one side of your body. Because warfarin is a blood thinner, you should be careful when doing some activities that put you at an increased risk for bleeding, such as using sharp objects like razors or scissors. You should also try to avoid activities such as contact sports, like football, that might increase your risk of a head injury. Activities such as swimming or walking are very safe. This doesn't mean you can't do the things that you love. It just means you need to be careful. So, if you like working in the yard, please wear sturdy shoes and use gardening gloves. If you have questions about any of your activities, just call your Coumadin clinic. It's very common that you may see many different providers for all of your medical needs. You need to be sure to let all of your providers know that you are on warfarin therapy. Some dental procedures require you to stop taking your warfarin prior to the procedure, and this is why it is good to tell your dentist far in advance that you are taking warfarin. If one of your providers writes you a prescription for a new medication, please let your Coumadin clinic know, just in case we need to adjust your warfarin therapy. So just as some final reminders, take your warfarin exactly as directed. Do not skip doses. Do not double up doses. Look for signs of bleeding or clotting and report them right away. Notify your doctor of changes in your dietary vitamin K intake, activity level, or medicines including herbal products, vitamins, and over-the-counter medications. Call your doctor if you have a fever, diarrhea, vomiting, or loss of appetite that lasts longer than 1 day. Limit alcohol to 1 to 2 drinks per day. Tell all of your healthcare providers that you are taking warfarin. Keep all appointments or call promptly to reschedule. Thank you for watching this educational video. Please use the tips and tricks that you've learned to help your warfarin work the best that it can be for you. If you have any questions, please call your Coumadin clinic.